Bit about the Interagency Council of Norristown.
The Interagency Council of Norristown is a health and human service consortium that serves central Montgomery County. So we kind of pride ourselves being aware of what exists in the community in terms of resources for individuals and families. We also participate in a lot of community-based coalitions.
Right.
So we are really informed, kind of have a pulse on what are the issues and the needs in the community, and then really view ourselves kind of as the clearinghouse or the bridge, so to speak, in being able to link organizations, county offices, schools, residents with resources that they are looking for to help them.
That sounds wonderful. So, I mean, I happen to have been involved with ICN for, so many years. And know that, you know, as a member when I first joined, that idea of talking with other professionals in the health and human service world and kind of realizing that we were working with some families with some issues that were similar, or that, you know, housing in particular was a problem recently, or, you know, any number of things, that helps strengthen the individual organizations. Also being able to turn to, you know, a listing of resources. Originally it was just a membership list, but it's really grown. And then you mentioned too, kind of connecting with other coalitions and other collaborative endeavors in the community. I know that ICN does some more formal work with the CAB and with other groups within the Norristown area within central Montgomery County. Can you tell me a little bit about that?
Sure. Well, I think first and foremost, the other significant component to our mission is building collaborative partnerships and trying to enhance the capacity of those member organizations.
Right.
Which includes schools, county offices, and nonprofits, small ones, mid-sized ones, some faith-based, and really trying to bring people together around an issue. So we're not duplicating services.
Exactly, great.
So by sharing information about the available resources, we can best help an individual or family rather than them being pointed in the direction of 3 or 4 different providers that may have a different way of you know, treatment plans, so to speak, or helping them or providing the resources, kind of making sure that we're on the same page. And so we do this through really bringing together some of the community-based coalitions. A few to mention would be Norristown area communities that care, the CAB, which is the Community Advisory, the Central Advisory Board, which is actually a 4th board committee of ICN. And the focus of CAB is a little bit different from ICN, where their focus is a little bit more on enhancing community well-being by looking at projects in the community that can bring together key stakeholders to improve, whether it be something that is focusing on neighborhood restoration, you know, a project like that may actually focus on a neighborhood block, versus ICN, which is really more provider-centered in getting the information in the hands of the providers.
Right, but that's great. That makes a lot of sense, and I especially appreciate the, you know, duplication or reducing duplication of services. As a provider of a small organization, you know, you can't be everything, and you shouldn't have to be everything. And if I could say, well, you know what, I can help you with this, but this organization can help you with that, that makes a lot of sense. Well, Eleanor, you're both somebody who works in a human service organization and an ICN board member. Tell us a little bit about how you might use this connection guide or the services of ICN.
Sure. Well, the connection guide has certainly expanded my understanding of what is available to people. So it's been a terrific resource for me in doing my job better. I work in the health promotion section at the health department. So as we seek to bring what we know and what we want to share out to the community, we need good targets. We need to know where to go, and it's very useful for that too, to just look at it, get the big view of who's doing what. It helps us chart our course and be, better able to reach the right people. So it's a very good guide, and it's great for our communications manager, our front desk people, because they're fielding calls and website inquiries all the time. So it's very useful within our department. And I also wanted to say too, as I'm listening to Linda, one of the things that I enjoy the most when we're in our meetings is the synergy of all the people there, because it's amazing to me, you'll have like a kind of a half-formed idea, maybe you'll bumble out with something, and immediately it'll start to take some shape, people add to it and shift it. And I was thinking of the mural project specifically as just a wonderful example of how something just kind of came out of one of our monthly meetings, and Amy Grebe, just really took it to heart, ran with it, and is working, in a way that I think is yet, like the potential that is yet to be seen, how much that can unite a community and make people feel healthy, well, and rooted. It's just a neat thing.
And
it wouldn't have
connected.
happened without us.
Right.
Exactly.
And connected.
Yeah.
That's really wonderful. Tell me, let's be kind of practical, hands-on. Tell me about this Connections Guide. And obviously, health and human service organizations, faith-based organizations, groups can use this to help direct their constituents in the right way. But how about a resident, and what might they find, and how might they find this resource?
Well, it's really kind of viewed as the yellow pages to Health and Human Services and some other, broad-based general community information. And it's really very easy to navigate either by a table of contents. So if you know what you're, say for instance, you're looking for some parent education, you would, look down through various different topics under education or family services. And under family services, there's actually a parenting section. It would take you right to the pages that have various different organizations or coalitions that could help you. If you actually knew the name of a specific organization, there's a comprehensive index alphabetically.
And so there's a little description about the organization and those services, and then a contact person.
Yes, absolutely. And then it also includes some broad-based information like elected officials,
Okay, great.
Municipality, other government resources that you may be looking for as well.
And that's available at the website, at ICN's website, for anyone to use?
Yes, it's on our website in full. If anyone has access to a computer, even if they utilize the Norristown Public Library, they would be able to print that guide in full there, or just navigate it.
And the website is?
www.icnconnections.org.
And then just one more piece, and unfortunately we're going to have to wrap up. There is a kind of a shortened version, the categories, the name of the organization, and phone numbers that people might find in their local human service organization. Because it's available. I know you said you've made these available to students and to families in the schools.
We have, and other strategic places like the Career Link, the County Assistant's Office, the courthouse, the commissioners actually have copies of them because they field phone calls all the time for someone looking for resources as well. That's also available on our website and is able to be viewed and printed as well.
Wonderful.
It was wildly sought after at the Family Summit, because I think it was.
It was, right.
The
That was
new
a
one had
piece.
just come out. People really want them. They know it's a good guide.
Well, I know and I value the services of ICN. I think the Connections Guide in particular is a great service. The idea of serving as a connector within these coalitions and issues that are important in our community is really wonderful. And I thank you both for taking the time to be with us this morning. Thank you.
Yeah. Thank you.